All right, so this webinar is being recorded. Thank you so much for joining us. We have a variety of people here to participate in this webinar. A few housekeeping items before Breena begins her presentation, just so that everyone knows. If you have any kind of technical assistance questions, there is a chat feature and you can select who those questions go to. Myself, Jen, or Maria, also from the Let's Grow Kids team, we're both available to help you with any technical issues. So feel free to message one of us and we will be happy to try and assist you. There's also a Q&A box. It has a letter Q on it. It kind of looks like a set of files in your Zoom bar. That is how we're going to be gathering questions for this webinar. So today, if you have a question as Breena is running through her presentation, you can click on that Q&A feature and enter your question. Maria and I will be looking at those questions, and during the actual Q&A time, we'll be helping Breena to go through all of those questions. We also have other folks with us who will be joining as panelists during that Q&A session from Let's Grow Kids and the Child Development Division. But today's webinar is really focused on the health COVID-19 guidance. So if you can try and keep your questions focused on the content of Breena's presentation, that would be greatly appreciated. So again, if you have any technical assistance issues, please feel free to use the chat feature to message myself or Maria. And if you have any questions for Breena during her presentation, use that Q&A feature to enter your questions, and we will address them during the Q&A section of the webinar. So at this point, I'm going to turn it over to Breena. She's going to go through her slides, and then when we get to the Q&A section, we will open it up for questions. And again, we are at full capacity for this webinar right now. So if you are not currently or about to provide emergency child care services, we would ask that you please sign off now and watch the recording. It will be available shortly so that you can make space for those that are waiting to join who are providing emergency child care services. So thank you so much, everyone. And Breena, I'm going to turn it over to you.
Okay, hi, everyone. I did want to just add in that in the communication that if we need to do this again, I'll do this again. So that I'm glad to hear we're at capacity, because I think that there's a lot of information we want to share and continue to talk together about this. I also recognize that we have school personnel, school administrators, and folks that are that may have heard about this that are joining, and that we were planning to do something later in the week for school administrators and hopefully school nurses. We're also going to repeat this with a little bit of a different Q&A with the Vermont after school folks later in the week. So this is not a one-time opportunity. I wanted to start by saying, oops, first technology problem, I can't advance my slides. Huh. Is that something you can do for me, Jen?
If you mouse back over to PowerPoint and click on it, you should be able to advance them again.
Except I'm trying to escape out of this. And let me stop the share briefly. Apologies here. Okay, that it worked so well before. This is such a bummer. Stop the share. Can you see those or no?
No, I'll take over. I'll share my screen and you can just tell me when to advance.
Okay, let me just try one more time. There we go. Okay. So folks, I just wanted to begin with a level set that we are in extraordinary times. I know many of you, I've worked with some of you. I'm a pediatrician by training. I was in Addison County for a long time. I've been in this public policy job for 10 years, maternal and child health director. I believe that what you're doing in your communities is just what I have always seen and grown to love about our community. I have so much gratitude for your willingness to learn about this virus, figure out how to take care of children and families during this very complicated and complex time. So just some resources and some reminders about where we are in the world right now. So we call this in public health the situational awareness. We have a website that is updated every day at about 2 o'clock that will tell you the number of new cases that came in up to the midnight hour, and that will have, we now have a map that shows cases by county. And I will tell you, it was 75 yesterday at 1, it's now over 100. I need to tell you that because we have to keep our situational awareness together. We have to know where we are on this curve. And the graph on the left, you've seen hopefully many times across state and national media, but we are trying to figure out how to push out the y-axis and with all of the measures to keep ourselves apart, especially when sick, so that we can decrease this surge into positive cases that require healthcare systems, especially hospitalization. So it was fully expected that we were going to be exponentially increasing our number of positive cases, and we're there now. I have no prognosticating ability. I don't know if we're going to peak at 500, 1,000. The case number is not always a reflection of how our communities are experiencing this virus, because the reality that you've heard about a ton is that our testing capacity is limited, and that's not really looking like it's going to change very dramatically. We do the best we can every day with the tests that we have. We've had to establish high and low risk criteria for the specimens, and I'd love to talk more with you about it if you're interested, but I don't want to waste a ton of time on it today. But I do want you to know that the number of positive cases is the tip of the iceberg, and we expect that there are, for every positive case, there are several cases that are not being tested. So here's what changed over the weekend that impacts all of us. In the first 3 weeks of this epidemic and outbreak, when there was a positive case, the health department staff, after the healthcare providers notified the patient, the health department staff called the patient, found out everyone that would fit the definition of close contact, which has a definition in our guidance and maybe in a subsequent slide. Those close contacts were then called, and they were advised about their behavior. They were checked in, it was checked in on their health status, and we had a group of people around each case contact that were in touch with public health. That's not happening anymore. The new protocol is the healthcare provider gets the result of a positive test. They tell the patient then is contacted by the health department, and that's it. The positive patient receives education on isolation, and the positive patient is asked to identify and notify their own case close contacts. There is one exception. If the health department identifies that the positive case was in touch with high-risk individuals, those are people in the healthcare field and in long-term care facilities right now. That's the definition of vulnerable and high risk. There is some follow-up that the health department is doing. So I just want to slow down for a second, have you hear that. So there's no more like the rumor that there was a teacher in your elementary school who's positive. A lot of it is rumor, but if the positive teacher tells the administrators and those around them, then everybody around them has the same information, which is how to define close contact and what to do with your own behavior. But there is no more sort of big health department engagement. And that's not some big dire thing. That's because it's now spread, this virus is throughout all of our communities. We're not able to attach each case now to a trip to Italy, visiting from New York City. So the most important sentence in the guidance that you all received over the weekend is that children, staff, parents, and guardians that are not well and that have been identify themselves as being in close contact with a person with COVID-19 should not come to childcare. And I really wanted to say at the beginning, I'll say in the end, we understand this is very complex, and we want you to know we're here. Public health staff is here for you to talk through different scenarios. So the leadership in the state, we've decided that a key way to alleviate concerns, but also control the spread of this virus would be to do a daily health check. And that involves both questions and checking temperature. The questions are, have you been in close contact with a person with COVID? And have you felt unwell? And you can ask this question of your staff as well, which is super important. And then we are recommending that you take temperatures of all the kids that are entering your facilities. Fevers defined as greater than 100.4. This is good old-fashioned pediatric advice. And this has been hard over the ramp up of this virus, but we really can't have kids returning until they've been fever-free for 72 hours. I think the complexity there is, you know, that there are many other respiratory viruses and kids are sick with things besides COVID-19. And we also recognize that this is a burden on people trying to go to work, but it is the guideline. If symptoms begin while a child is in your care, they need to go home. And this has always been true, but I think just a little bit more attention to the decision about that, and also the speed at which you remove a child from close contact who's not well. I think this is pretty clear, but I do want to remind you that there is a vulnerability in this virus to people with who are over the age of 60, and also those who have underlying medical conditions. We are also asking that pregnant women be excluded from provision of care. The science is still building around this virus. I know you have all been reading that. We don't know as much about it as we know about influenza and other respiratory viruses. So in some populations like pregnant women, we're erring on the side of caution. The box on this slide describes if you're a home-based childcare. We do need to consider the other adults or the other people in your home and what their chronic disease status is, and also their current illness symptoms are. So if the household member has any of those conditions or are not feeling well, there has to be some clear distancing from where those adults or children are and where the kids you're caring for are. So this is our commitment to you, and this can change depending on a variety of needs, but we wanted, maybe many of you have already felt that you've had access to our maternal and child health nurses. I hope that's true. We have a staff of 4 nurses, some of whom you know. Sharon Lee Treffry is our state school nurse consultant. We have Nathaniel Waite, who's in charge of the way we spend Medicaid dollars in schools. And then we have 2 other nurses, one oversees home visiting, Margaret Charmy, and one is Sally Kirshner, who's been doing public health nursing for us for 30 years. Those 4 people have been answering questions for weeks from childcare and schools about the health of children and their staff. We set up 8 to 3, and we also have a mailbox. We could change this if these hours are not going to align with when you need to be making your decisions. The 863-7240 number has a mailbox that you press 4 to select childcare services, and that is, it's seeming to work, but I'd love to hear from you if it's not. The next few slides are just the general guidance to remind everyone. It's all written and you've seen it, but the close contact decision is that we're going to limit classrooms or rooms to 10. That includes the adults. That's a change from a few weeks ago, and I really apologize for the confusion. I should have said at the onset that this, the guidance and the best practice and how to communicate with everyone is changing almost daily. I do imagine we're going to need to talk more frequently, and we can do this every couple of days. We have a almost daily call with pediatricians and family medicine docs as well. I'm not going to go through all this because I think you all know this. These are the really important infection control general principles. They're just a little bit elevated from the way you've always conducted health and safety in your work. Couple more things that we're hearing tons of questions about, and this I hope you're putting in. I can't see the chat box, but this is sort of how we've been slowly getting the word out as this virus has increased in Vermont, and each one of these frequently asked questions has materials on our website that gets updated every day, and so you should really enjoy this website daily because it's outward facing and full of information. Okay, I'm going to stop there. See if I can, and I think some of our support folks are going to start to call some questions and put them in a way that I can answer for you. Sherry, do you want me to start reading these? Yeah, I'll let you guys tell me what you want me to answer because there's so many.
Yep, Breena, this is Jen. I'm going to help you triage all the questions that have come in. I'm also going to add Donna and Sherry to video as panelists so they can help answer some of these questions as well. So just give me one moment to do that.
Is it okay if I start talking, Breena? Because I see.
Yes, go ahead.
I don't mean to not do these in order. Maybe that's not fair. But so the question about pre-K is a great one. So we believe, no, you don't have to be a health professional to check temperature at the door. We were hopeful that you all have thermometers, and if you don't, that's an important public health topic. The role of school nurses in this work is evolving. We're trying to engage the school administrators and the school nurses together so that we can figure out in the LEA what's going to be best practice. And so stay tuned on that. If anyone on the call is a school nurse, you really should stay in touch with Sharon Lee Treffry because she's keeping up to date on the guidance. And but no, health and safety, the good old fashioned temperature taking is, we believe childcare providers are equipped to do so.
So
okay,
Breena,
yes, go ahead.
One of the big questions that's been coming up is if there are staff that are over 60 and in good health and want to work, can they continue to work, or should all staff over 60 be excluded?
It's a great question. I'm going to be definitive and say that we really don't want people over 60 to provide care. But what I will say is at 2:30, I'm presenting these slides and talking with Child Development Division staff and the licensors and the folks who have been collecting the need versus the supply of this important, essential and emergent care. And I don't know if they will change that requirement. So we're starting with big recommendations like that. And there may be, in everything we've done, including in healthcare in the last few weeks, has had some modification, some waivers, some nimbleness. So I think it's safe for me to say right now we haven't made that decision. 60 or older not providing care.
Another question that has come up is if a program is providing care for those emergency health workers or health workers in general who are working directly with patients who have COVID-19, what are the considerations around that?
Yeah, so let's do a little scenario. I thought about this. We get a lot of calls about this. So I wanted to say at the beginning, you all, if a child or a staff person in your system gets COVID-19, there's not going to be any evidence where they got it. So, which is, I hope, a little bit helpful to the energy around this, so that it's there is going to be exposure for many of us that has already occurred. There's going to be exposure with, you know, doorknobs and just some things we have to go out and do. We're going to risk exposure. So if you're caring for a physician's child or a nurse's child and they end up sick, we'll talk you through it, but there's a lot of ways to proceed. You start with the most important medical information right now is when people don't have symptoms, there's very little spread to each other. That doesn't ever want you to feel like I'm being an absolutist, but that's not spreading this virus when you don't have symptoms is a very low part of this story. So sick people should come nowhere near you. Can you hear me? Something happened. It just flipped off briefly. Can you guys can hear me? You're nodding. Okay. So this is really important. So the person, you should really call us and we'll talk you through it. It's super clear to us, but hard to translate, which is if the person who's positive didn't come in with symptoms, then you can have business as usual. But the kids of that child, of that positive case will be asked to stay home. And so you just have to tier it. You know, was it a parent of a kid and the kid's been fine, then the parent isolates, the kid isolates. If it's a childcare provider's sister and they don't live together and they haven't seen each other in a few days, and the last time they did, the patient that's now positive didn't have any symptoms, business as usual. And the reason that, I mean, this is not to say this isn't a really hard time, but we are wondering and know that many people have this virus without positive tests, partly because we're not testing them, partly because they're not really that sick. I really wanted to remind everyone too that, you know, kids aren't getting that sick. And I know you're going on the media the way I am and you're hearing like anecdotal, really scary stories, but there's some good epidemiologic data coming out of China and South Korea that the bell curve of this illness, there's less symptomatic infection in children and there's much less significant illness. So we just have to keep reminding ourselves that sick people spread this virus. We're going to be around sick people. We're going to distance from everyone sick. And when you get a positive case somewhere near your work, call us, because you're going to just need that slow, rational medical approach. And I don't blame anyone at all for worrying environment, but it's just, we'll take you through the medicine and the common sense of who was the person, who were they in touch with, were they sick when they were in touch, and who needs to now come, whether it be someone on your staff or one of the kids in the program. And I did want to address one other thing, and then we'll go back to the chat, is the notion of kids who already cough baseline. What pediatric infectious disease folks are advising and pediatricians is we still need care for children with asthma. We still need care for children with cystic fibrosis. We still need care for children who have other chronic reasons they cough. If those diseases are well controlled, then we need to find care for them and not worry they have COVID-19.
Maria, do you want to share some of the other questions in the queue? Oh, Maria just lost her connection. Just kidding. And if anyone else is experiencing some issues, we know that some people are having trouble maintaining connection. We believe it's a Zoom issue right now, so apologies for that. I think their system, now that they're supporting many schools with online education, they've been experiencing surges over the past few days. So The recording will have the entire session available if you have lost it at some point in the session. So I'm going to give Breena a moment to jump back on. Perfect. So Breena, you're muted again.
Okay, I'm back. I don't know what's happening. I have 5 bars. It just keeps connecting, but here I am. Anyway, more questions, I think.
Yes, we think that it's actually a Zoom issue that has been kind of limiting how people can join and unjoin. So one of the questions that we also got, and I apologize if you answered this while I got booted off and then back on, was there was a concern about water fountains and how water should be provided to children in childcare programs. Should water fountains be avoided? Should there be using bottled water? What's the best way to kind of manage drinking and water safety?
It's a great question. I can try to find an official CDC answer, but my public health answer is put the water into a cup, and cups should all be separate. Because the water coming out of the fountain is going to be fine. It's when the mouth touches the fountain that there's infectious risk. This is an interesting time for environmentalism. I just wanted to say that to my great colleagues who think about things like I do. You know, even reusable bags are being called into question, which is just a very, yeah. There's been I have some great guidance for you I can send. We just did for school nutrition programs who are doing a lot of work with food in communities. I hope you're a part of that to hand out to families. And I'll forward it along, that food does not appear to be transmitting this virus in any significant way. So we you can still have fresh fruit and you can still feed kids with the current source of food. Other questions? Should I look at the chat box since people? Okay.
So there are a number of questions that have also come up related to essential personnel. And just so everyone knows, there is an official list of who are considered essential personnel on the state of Vermont website. We will share the link to that list in the chat so that you have that link. So we'll get that up momentarily for everyone.
Yeah, it's super important topic for us though, because as you know, it is unlikely we will have the number of slots in these emergency childcares that we need for the current list of essential workers. So I just wanted to acknowledge that there is some very high level conversations way beyond me occurring in how on earth we would ever prioritize essential workers. And I don't have any answers. I just know it's not the land of plenty currently, and that's a concern as well. So stay tuned.
Related to the questions around temperatures, a couple of follow-up questions have come in related to whether staff should be documenting that temperature every day in like a special place specifically for during this emergency childcare period. And also related to that, is there a specific type of thermometer that's recommended, or a special way that you should be taking temperature?
You know, I think we spoke to the type of thermometer in the guidance. I'll double check, but no, there's the beeping oral ones and the ear ones and the forehead ones are all valid, when they're as long as they have the right batteries and all that, they're all fine. And no, there's no expectation you're going to document the temperature. This is just, no one with fever should enter the building. You take the temperature, you send them home. You take their temperature, it's normal, below 100.4, they go in. So we're not trying to add to the regulation here. We're just trying to add to the screening and the comfort, much like they're doing. And I don't know if folks have seen, I should say that I'm trying to, UVM Medical Center has signs at the front of all their health clinics that just says, stop here for a second, we're going to check your temperature. And I'm trying to get we're all sharing well, and I'm trying to get the signs for you. I should have said that at the beginning. So you guys can all have the sign that just says, hey, same as the pediatric offices and all the other medical offices, stop, we're going to take your temp, and then admit you if you're without a fever. And same with your staff. But it's not a regulation. It's just to add some comfort and safety around all of us that you have some objective data. Many states are actually just having parents make that decision at home. Does your kid have a fever or not before coming into emergency care? But you're great advocates here with the Let's Grow Kids and the Child Development Division. That was a really important part of our, last Friday, Saturday decision making, just to put that a little bit in your hands, which I like.
Another common question that started to come up is about common spaces in childcare programs, and such as playgrounds or common bathrooms, and what should be the practices around making sure those spaces are clean and safe for everyone who is, all the children and staff who are going to be present.
Such a great question. The cleaning recommendations are very clear in the guidance, and it's just that normal cleaning procedure, but with heightened frequency. The ideal environment would be that groups of kids aren't sharing bathrooms. So what we're still trying to figure out is, should we be cleaning bathrooms in between? Isn't there a bathroom for each 10 kids? And you guys know better what these mathematical issues are, but if you're a particular center that knows there's not one bathroom for 10 kids, we need to talk about some increased cleaning procedures. Playgrounds, I think, are just common sense, the way we're describing the food handling. The playgrounds are, they're outside, they're exposed to a lot of circulation of air, and we're just going to have groups play on playgrounds.
Another question that's come in is, are there any other viruses or other active kind of diseases that are closely mimicking COVID-19 that programs should be aware of when they're doing monitoring?
It's a great question. Respiratory syncytial virus, RSV, influenza. Still, and March is our peak time for both of those viruses. So what your pediatric healthcare colleagues have been doing is trying to test for those. In the old days, we wouldn't, you just sort of assume kids had the flu. You didn't always stick the swab up their nose. We definitely didn't. We worry about RSV most in babies. And so older kids were like, you might have RSV. Not anymore. Now we're swabbing and testing, because if they have those diseases, it's a much less likelihood they have COVID-19. It doesn't mean they don't have COVID-19, however, and that's another important nuance. There could be co-infection. So sick kids don't come. No sick kids in the buildings, in your houses, which is a bummer, because in the old days, I know you'd have a kid on like day 4 of RSV and the fever had gone, and you're like, oh, less contagious, he can come, she can come. So the restrictions are tighter for this illness piece, which is, good for public health in general. It's just, I know that the need from the workers is present. So we're right on the bubble here of making sure essential workers can do what needs to be done at the same time we're caring for children.
Related to that, a few follow-up questions came in just to clarify. So if a child is expressing symptoms such as a cough but no fever, should they be excluded? So some kind of symptom but no fever.
So new cough, we should exclude. It's the kids that cough anyway that we need, and this one's hard, because what I'm hearing from your colleagues, many of you are stepping up to care for kids who are not previously known to you. This is not your group. And so you don't know their medical history, that they've had a touch of asthma and they get a little cough when they go out and run around the playground. So those kids we have to talk to the pediatricians, and this is extra work, and I'd love to help you with it. If you have new kids to your program and and the mom says, oh no, they've been coughing for 2 years, they both have asthma, I can help connect you to their medical home and get the medical folks to say, yes, that's true. I feel good that this is not anything to do with this virus. So what I'm hearing is kids with very significant health conditions are self-selecting to not seek care because the risk to them is too great, but they do cough. So, but there are going to be some kids who have chronic cough that need care. And I'm hopeful it's not so many people that we can't help you case by case, or at least get the medical piece in place. So it's not as easy in kids to say fever, cough, shortness of breath, partly because, as you know, kids are sort of resilient. They don't mount tons of fever all the time. We also use our ton of products to suppress fever, which isn't meant that, I don't think people are being subversive. I think we're just Tylenol, Advil humans. So the absence of fever isn't a perfect reassurance. So that's why I want to work with you all on cough. But new cough, stay home.
Another question came in about how best to support children who may require a one-on-one support for personal care, behavioral needs, or other special needs. And are there any special guidance considerations relating to health that should be taken into account?
I mean, I do want you to know, and you can imagine, we have long lists of the groups of people that we're providing guidance for and helping, and children with special health needs, and the children with developmental disabilities, and children who require personal care. It's all iterative, and we're doing our best to provide resource guidance. But in terms of anything special about the care of children, no caregiver should be sick. And if the child with the special consideration is sick, they should stay home. So, but the one-on-one piece is the same, whatever those, your guiding principles are around that work, just make sure no one's sick.
And there are a series of questions, Donna, I think you might be the best person to answer them, that have come through about what if a child has one parent that's an essential personnel, but the other parent may be doing telework or working from home, or may have been laid off. Are they still eligible? And then also, what if parents are considered essential personnel, but they've been granted a telework leave or a telework situation? Are they still eligible for childcare?
So to the question of the person who's essential, but they may have another partner home, we've been saying if there is someone at home who can care for the child, that child should be home. It can become more complicated if that other adult is essential but working at home. For those that are essential and working at home, they can still get childcare provided, because often if they're essential and working at home, they can't work if they're also trying to care for the child. So they can still be in care. I think it's talking to the families about their judgment and why they're trying to send their child. But if there's one essential parent, they can use childcare. But we're also talking to folks who, if there is a parent home who's not essential, that child should be home with that parent. And keep looking at our website. We update frequently, ask questions, and as more information comes to us through all our different partners and the governor, we update that. So things sometimes change. What could be an answer one day may be slightly different or much different the next day.
And Breena and Donna, this question, it might be a team answer. So there are a couple of questions that have come in about staffing and whether staff can move between different groups of children, or should staff be dedicated just to one group of children? What is the best guidance right now from kind of a health perspective and also licensing perspective about how, if you are offering emergency childcare and you need to keep those ratios down to less than 10 adults and children in any one group, how can you move staff around, or can you not move staff around?
Well, I'll do health, and then Donna can do ratio. Health is if a person who's well can care for anyone in any room. It's all just staff should stay home if they're sick. So, but in terms of if moving from room to room, again, I could draw out the medical trajectory of this, but you can have symptoms, you can be exposed to the virus, be well for 13 days, and on the 14th day develop the virus. That's develop symptoms from the infection. That's why 14 is the quarantine window when people come back from, Europe and China. So one of the things that's come up, and I'll just hit it head on right now, is folks are wondering, could childcare providers all be tested? Like this would be, in a land of plenty when we had adequate test supplies. And the answer is, well, that's not recommended. If we test a childcare provider today, reassure a group of people this person is free of the virus, tomorrow they could have the virus. So we're not doing testing because we're not going to do daily testing of children or providers. And we're also going to accept together with a lot of support that many of us are going to have this virus if we already haven't. And there are some estimates that 40 or 50% of us are going to have had the virus by July. So I don't know if that's reassuring or alarming. It's reassuring to me because kids aren't getting sick the way our very vulnerable elderly population is. So we can get through this with community cases and people getting a little sick and then well. But anyway, that's all to say that there isn't a way to sort of protect a provider with a certain group of kids. The workforce that you're standing up and willing to participate in can be as nimble from a health perspective as you need to be. I think Donna may have an answer about moving and ratios, but from a health perspective, all good.
So certainly the ratios need to be maintained. And, now it's not just children, it includes those for caregivers. We always recommend that you have an assigned caregiver or caregivers for a group for consistency with those children and connection. But certainly for people who may be doing sort of shift work or certain days of the week or certain times, that's going to happen and that's okay. The important thing is to keep the right ratio for adults and children. And as much as you can keep consistent staff with children, that's going to benefit the children, especially when you're doing emergency care and these kids may not have been coming to your childcare previously, so it's a new environment for them. So as much as you can keep staff consistent in that room for their well-being and connection, that'll be beneficial. But certainly if staff need to shift because of times that they can work or that kind of thing, then that can happen.
Another question kind of loosely related to ratios, but if you have a number of different groups, can they all be out on the playground or an outside play space at the same time, or should it only be one group at a time?
Yeah, I'll take that one. It has to be just 10 people. I don't know if this is reassuring or not. We're just working with the best we understand the transmission of this virus from our colleagues around the world, but also Washington State, Maryland, some of the people that are a little bit ahead of us, New York City, to pick this arbitrary number of 10, but we're sticking with it because we just need some guardrails. 10 people on a playground, and then another group moves in. Yeah, sorry about that. I love the idea of kids being outside. I think, I'm a little unclear what we're going to do as the week progresses with the school age kids, but I do think that kids can handle developmentally the conversations about social distancing as they get a little bit older. But since this crowd today, we're mostly in the littlest kids 0 to 5, I think we have to be very sure about that 10 on a playground. I did want to say too, because something just reminded me of this. I think you guys are all experiencing something that we are as well. First of all, social media. I'm really struck. Facebook is a wonderful way to connect with all us feeling isolated, but there's so much misinformation out there, so much. And there's misinformation about a lot of public programs and WIC. And I saw something this morning. People are telling people to make their own formula at home, which is so unsafe. And we do not have a formula shortage. So this is a whole layered time. And I think for you all, staying in touch with me and my team so that you can be one of the great faces of calm, reassuring, and accurate information for families. I'm just so grateful that you're part of that workforce the way that the pediatricians are as well, because you can go a long way to help people not think that it was the lady at Hannaford that gave someone the virus and now the bus driver has it. I mean, I know you've heard these stories, and they're sort of heartbreaking to me because they put people in the middle of this, and that's unfortunate, but they also promote this sense that that some people are spreading it to us, and that's not true anymore. It's community spread, and it's part of our reality for a few more weeks, hopefully only a few more weeks, a few more months. And I just appreciate you all and the role you play. And then I did want to tell you, like the second webinar for all of us together is about the social emotional needs of kids. And we're super worried about the impact long-term of this type of energy around our children and all the fear. And so I have a lot of great resources we're pulling together around talking to kids, the emotional support of kids. We're worried about increases in child abuse from isolation. We're worried about domestic violence, nutrition, all the things you guys are the absolute cornerstone of in our communities. So today is health in a more traditional sense, but let's keep talking to each other about the broader context of health as well.
Another question came in related to children with specialized needs. If they, can they still attend childcare if parents are not essential employees?
Okay, that's a heartbreaking question. I think I'm going to have to say in this short-term current emergency environment, no, probably no, because there's such limited slots, and we have these people that have to go out and do our essential work. But it could move quickly. I'm trying to get back to a strength-based Breena here. Let's get through that. We could peak and be all talking about the broader context by April. So end of April, May. I'm just trying to be hopeful. Okay, I'll stop. But Donna, did you have another? I don't think we're doing anything beyond essential workers right now.
No, it's just what is on the governor's list for essential persons. And we're certainly updating as that's updated. It has already been updated once to include some other folks. But whoever's on that list is who we consider essential. We have heard from some families that their business says they're essential and they need them there. But if they're not on the list, it's not part of the essential persons that we're providing care for at this time.
So a follow-up question to that came in as you were both talking about that. What if programs have offered to provide emergency childcare, they still have slots available? They have those families who are saying, well, my employer told me I'm essential, or I have this child with specialized needs who usually comes to you and has this plan to work on their development. How should people be navigating that?
Do you want to take that one, Donna? I mean, I think if you have slots, first of all, awesome. And second of all, like I need Sherry and Donna to remind me, what that process is, because let's get those slots filled with essential workers, kids. However, I mean, I guess I could imagine a world where when we have all that settled out, wouldn't that be amazing if there were still slots? The other thing that's coming, I think later today, the governor is doing, as you can tell, this sort of stepwise process of really encouraging more and more people to stay home, and businesses are even being encouraged more to do that. And so I don't know if these folks who are saying their businesses are requiring them to come in, if that's going to be the reality today, tomorrow, Thursday. It feels like that's shifting as we speak.
So I'll say to the question about essential persons, if they don't meet the governor's criteria of essential persons, they cannot be provided essential care at this time. So right. That's just a solid answer. I saw some other questions about, like, should we be asking for proof from folks that they're essential? We're not asking anybody to do that. if it's what I said about the essential person is, say there is someone who's a medical professional in a family or just works for the medical profession in any way, shape, or form and need to go to work. But their partner is home and not working. That's where we're saying that child should be home with the non-working partner. Even though they have an essential parent, if they don't need childcare because they can be cared for in the home, that's where they should be. But beyond that, you would work with the families and find out what their need is. But as long as they have at least one person who meets the essential persons list from the governor, that's number one criteria for care. And then beyond that, you would be asking, is there a parent at home who can provide care? That's where that child should be. If there isn't, or both parents are essential persons, then obviously they would need childcare.
There have been a few questions that have come up about supplies like hand sanitizer, toilet paper, and people who have tried to place orders and things are back ordered and just not coming in. What should they be doing in order to try and secure those supplies if they're not able to find them through their regular channels?
And this is Sherry. I can take that one. And Let's Grow Kids is working with the Child Development Division to try to provide resources for those programs offering emergency care. So sometime at the end of the week, there are some frequently asked questions that I think are going out today, but there'll also be another batch of frequently asked questions regarding emergency care that will be going out at the end of the week. And there will be a link in there where you can, if you are providing emergency care, where you can request a Let's Grow Kids team member to connect with you to find out what resources you're lacking to be able to continue to provide that emergency care. And then we are going to try our best to get those resources so you can continue to provide the care. So you should be looking for that coming out probably Friday with the email and update and frequently asked questions from the Child Development Division. And Let's Grow Kids is hoping to be able to reach out and help in that way. I also wanted to mention, Donna, you might have seen some questions. People are saying like they've offered and they don't have space, that like they haven't been contacted yet. Do you want to speak just a little bit to that too? Because I don't want them to give up.
Yeah, absolutely not. Please don't. So what's happening is we started out with one system to try and capture that information. It wasn't able to be pulled easily for us to figure out where to link. We're now using a different system. So hopefully you guys have seen all the JOT form and you filled out a JOT form. If you had a phone call that you gave information to a licensor before the JOT form came out, we're trying to get all that information into a JOT form. If anything has changed, please feel free to fill out another JOT form because that's where we're pulling that information now. And so we're still correlating all of that and organizing it and getting it to the resource folks in each territory to then, as parents fill out the essential persons questionnaire saying they need care, linking that to folks in their community that are providing that care. So we're still standing up the whole system. Please have patience, but we are keeping track of that, doing the best we can. Our team is still 12 licensors and 3 supervisors and 4 technicians. So we're all trying to work together to get this work done as quickly and efficiently as possible, but it is a process. So please feel free to reach out to your licensor. If you haven't heard anything, hopefully they can update you. And we are mobilizing that information more and more each day. And so you should be hearing. Thanks.
This is Breena. I just, I took a look at the Q&A and I'm going to talk to Jen about the technology about this. If we can, there are lots of little important questions that I want to be able to answer for you. I think I'll just put it out to all, like things like under the arm. So it's a little bit of a myth that you go under the arm for temperature and you add a degree. We certainly have used that in times when kids with developmental needs can't get a thermometer, tactilely, but it's not ideal. Little things like that. And then there was a question about the false positivity of the test. The test is highly sensitive, which means it does not have false positives. There are some inconclusive results, which they then run again. It's just that the reagents weren't quite right and we couldn't extract the virus. But in terms of finding out that you have a negative test for COVID is very reassuring that day. I mean, that's the only bummer is you're negative today, you could be positive tomorrow because of the exposure. So, but many, many more of those types of questions. Jen, is that an easy thing after to pull? The Q&A doesn't go away when we hang up, right?
No, so this is actually a good time to kind of recap everything for those. I know some people got booted in the middle, including myself.
Me too. Yeah, I did
Zoom
too.
Zoom was, as I was saying before, providing free support to a lot of schools right now. So there have been a couple of cases where the system gets overloaded. I think that happened to all of us today. So what has been happening is in the background, Maria is amazing and has been taking notes on everything coming into the Q&A.
Excellent.
Because every time your connection resets, the Q&A resets. So we have been trying to collect all those questions as we've been going through, and she's been frantically taking notes this entire time. So we have a backup of the questions coming in. So what we're going to do is there will be a recording of this webinar available. And that information, I'm sure, will go up on a variety of different sites and available through a variety of different sources. We will also take that Q&A list and send it to Breena and Donna and Sherry so that they can help answer a lot of those questions. We'll get those turned around and available with the link to this webinar recording. And then if there are any questions that go up on that have been missed, you can reach out. Breena had information available in her presentation about how to contact her team. And you can always contact your licensor for CDD for information. So we'll make sure that there are different ways that people are supported in getting those questions answered.
Excellent.
So Breena or Donna or Sherry, are there any kind of closing pieces of information that you want to make sure that we share with everyone?
Yeah, I just want to say that I'm so grateful for all of you, and we're all in this together. So, 8 times 8 ways, email, call. We're starting to understand what we need to be saying, but every day brings new challenges. And I think our partnerships are what make Vermont great. And thanks for caring so much about kids and families.
And this is Sherry, Let's Grow Kids. And I will just add that we are, our Let's Grow Kids website has a COVID-19 resource page that might be helpful for folks to look at. And we are working on many other strategies to provide, to support childcare programs now, trying to plan ahead for what might be needed later, including some supports around maybe filling out forms when there becomes a clear idea of, what kind of relief or what kind of stimulus packages might be available. All of those things we're trying to be hit the ground running. So we're ready when you all are ready to get back to business as usual. And then in the meantime, we have a team here that's willing to, if you just want to have a chat, you want some resources, we're trying to stand up things like free professional development that counts for training so people can be doing things in the meantime. We're happy to hear your ideas of things that you may feel are needed for the field. So we're open to just really supporting the field. And we want to thank all of you who are taking care of the essential workforce. And I want to be hopeful like Breena, but I think I'm really grateful you're there. If you haven't connected yet and let CDD know, please do, that you would be available for that. It wouldn't be surprising to see the need increase. I think there's some temporary situations right now where someone has a neighbor that's watching them thinking this was a 2-week thing. And so I think we may see a boost in the need, and it will be good to know where those spaces are available.
And I'll just quickly say thank you all for the essential work that you are doing. Please reach out to your licensor if you need to. We're here for you. We're working all our normal hours, just at our home offices as usual. Our website also has a COVID-19. So when you go on the website, there's a big red banner. It says COVID-19. Click on that. It links to a lot of different places like the Department of Health, but it also has our frequently asked questions that we keep updating. And other information. So that's a really great place to start. And then from that, if you don't find an answer, please feel free to reach out to licensor on duty that line is still up and functioning, your licensor, we want to be here to answer your questions.
All right, everyone, thank you so much for joining us again. Really
Thank
appreciate
you.
it. We will let folks know what the link is to view the recording of this website and the answers to all of the questions that have come in. It'll take us a little bit of time to get that process, so I can't send you the link immediately. It actually has to process up in the cloud and generate the link. But once we have that information, we'll be sure to send it out to everyone. So thank you again so much for joining us today.
Thank you.
Thank you. Thank you, Breena and Donna.